Hi, this is Steve Adubato. We are, in fact, as you can tell, coming to you remotely. It is my honor to introduce a very special set of guests. And this is, by the way, this program is all about the role of not-for-profits, nonprofits in the age of COVID, and also looking at the experience of a particular community in Newark, New Jersey that I grew up in, the North Ward of Newark, and it's the impact that COVID has had on it. It is my honor to introduce Michele Adubato, my sister, but way more importantly, she's the president and CEO of the North Ward Center, a not-for-profit organization in Newark. Marsha Atkind, who is the executive director and CEO of the Healthcare Foundation of New Jersey, a funder of the work that we do, and also Newark Councilman Anibal Ramos Jr., who represents the North Ward of Newark. It's good to see all of you. Thank you for joining us.
Thank you.
Thank you, Steve.
Let's set this up. The role of not-for-profits. Marsha, describe the role of nonprofit organizations, not just in Newark, not just in the North Ward, and not just the work that Michele and her colleagues do at the North Ward Center, but why are nonprofits more important than ever before in the age of COVID?
Oh, my goodness. Nonprofits serve people who are in need throughout our communities. So it could be people who are hungry. It could be people with special needs of all ages. Nonprofits run cultural institutions. Nonprofits run schools. Nonprofits run all kinds of organizations that we depend upon as a society to help improve the quality of life, provide medical care, provide mental health care, all kinds of care to the people we care about.
By the way, to be clear, the Healthcare Foundation also funds not-for-profit organizations, including the North Ward Center, including our not-for-profit production company. Michele, the work of not just the North Ward Center, but your colleagues in the nonprofit world, by the way, huge financial challenges, not just for us, but for everyone. But how do you provide the services you provide in a community so devastated by COVID with serious funding challenges?
It's not a choice. We have to provide these services. We are on the front line of this. If we don't do it, no one else will. And without the help of foundations like the Healthcare Foundation, we would not be able to do that. And what I mean, I'm going to give you a quick example.
Sure.
When this hit back in March, I also founded the Center for Autism. This is an organization where these are adults, 50 adults. We provide day-to-day services for them. They had to be home. Obviously, we were shut down. We couldn't allow it. We couldn't allow them just to be home. We had to provide some sort of services. The immediate first thing I did was, what are we going to do? Who are we going to go to? I thought of Marsha. I did, because she's my go-to person. And the Healthcare Foundation had said there are emergency grants out there. So we immediately applied for an emergency grant within 2 weeks, and this is unheard of. Within 2 weeks, we were able to get every single one of our clients a Chromebook, set it up in their house, and today they are virtually live streaming for 5 to 6 hours with other type of services. That's all because of the Healthcare Foundation.
Well, and so we don't turn this into a commercial spot for the Healthcare Foundation, which is warranted, but that's not our goal. I want to ask you, Councilman. Someone says, hey, wait a minute. Isn't that the role of government? Shouldn't government be doing these things? Government can do only so much. Fair, Councilman?
Very true, Steve. I mean, we're very fortunate to have organizations like the North Ward Center, foundations like the Healthcare Foundation in New Jersey. I'll give you one example. Here in Essex County, we typically have an average of about 3,000 seniors that attend nutrition sites throughout the county of Essex on a daily basis. These nutrition sites provide, access to healthcare information, nutritious meals, other types of support services. And during this COVID crisis, naturally these centers were shut down. And thanks to the county and the city's partnership with organizations like the North Ward Center, CAUCUS, and a number of other non-for-profit groups, we were able to transition very quickly into delivering meals at home, which was quite an undertaking. And Michele and I had an opportunity to talk regularly to see how that process was going. And that's just one small example of how important it is for whether it's a municipality, the county government, or the state, to have, very effective partnerships with the nonprofit community so that we can get services delivered even during a crisis like the crisis we're in.
By the way, let's make it clear. The North Ward of Newark, I shouldn't say 1/5, it's one of 5 wards in the city. If we make the North Ward of Newark or the larger community of Newark a microcosm of other urban communities across the state and nation, Councilman, real quick, how bad did COVID hit the North Ward?
Well, it hit us bad in a number of different ways. We obviously had the zip code with the most positive COVID test results, but we also had the largest number of people who were actually tested. We're home to 2 of the largest nursing homes in the city of Newark, and just between those 2 nursing homes, we unfortunately lost about 60 residents. So COVID has hit us hard. But it has brought out the very best in our community. Another example of effective partnership, we partnered with a federally qualified health center known as St. James Healthcare, which is a non-for-profit. And one of our concerns from day one is, what do we do with our seniors that are homebound, that are living in our very large senior housing complexes? How do we get them tested? And thanks to that partnership with St. James, which my office was able to set up, we got over 1,400 seniors tested who probably would not have had the opportunity to go out to one of our testing sites. So we recognize that testing is fundamental in this process, and it's essential in order for us to effectively contain this virus.
Well said. Marsha, let me follow up with you, and I'll go back to Michele in a second. So, Marsha, not-for-profits coming to your foundation, and by the way, we've done a whole range of conversations publicly and offline as well with Marsha about the role of philanthropy. How much pressure is this putting on the philanthropic community, foundations like yours and others, with not-for-profits, more pressure on them than ever before to provide services during COVID when government has less money, nonprofits have less money, and you don't have a bottomless pit of money?
That's a question we could spend an hour talking about, but let me just bifurcate it a little bit. For foundations, the pressure is, should we give away more than we normally give away? And if we give away more, if we award more in grants than the IRS requires that we do and that we would normally do, what
in this crisis, you mean? You mean in this pandemic?
In this pandemic, right, as a result of this pandemic. What does that do to our ability to meet needs next year and the year after and the year after that? Because we would be depleting our endowment. Because we're a foundation that doesn't raise money. We have an endowment and we spend from the endowment. On the other hand, the nonprofits we support are meeting needs that are much greater and more widespread than ever before, and having less ability to fundraise, to have events, to meet their own budgets. And the Chronicle of Philanthropy just issued a survey in its latest issue that says that 13% of the staff of nonprofit organizations across the country has been laid off.
That's right.
Now that's enormous. I mean, that means that nonprofits have to do more with fewer people. And they have to do more in ways that cost money with less funding to do that. So, Michele just talked about buying Chromebooks for all her
at the Center for Autism.
Yeah, for all her clients. Schools have to do that. People who provide mental health services have to do that. It's endless. And as you said, Steve, our endowment is not endless. So there's that tension all the time. But we at the Healthcare Foundation vowed that we were going to do all that we could to meet this crisis. And so far, we've given away about $4 million in grants.
During this period? So say March to when we're taping in middle toward the late end of August? Seriously?
Seriously.
Michele, let me ask you this. Our not-for-profit, the CAUCUS Educational Corporation, obviously we innovate, we're creative, we had to adapt. We're not in a studio at NJTV or WNET at the Tisch Studio in New York. We look forward to being back in those studios, but we're not there now. Our level of innovation is off the charts. What about yours at the North Ward Center? And the need for nonprofits to be incredibly innovative in these times and do more with less?
Well, besides being innovative, I think one of the things that we have to look at is relationships, okay? if you just began, if one thing nonprofits need to learn from this is you need to have good relationships with your council person, okay? Anibal and I would have remember our Friday morning breakfast that we miss, right? We miss our breakfasts. And we would just meet just to talk. And he would talk to me about things that are going on. So we would make sure that, Anibal and I have had a relationship for many years. So when I called him, it was an easy call. Marsha, the same thing. So one of the things nonprofits have to learn about this is you need to know who your community leaders are, not just your community. You need to have a relationship. And one thing I'm going to say about the North Ward is I really think that we are a lesson to look at to say how you should lead in a neighborhood. Anibal Ramos has been out there on the street, okay? He is I worry for him. And he has his mask and he's doing his social distancing, but he is out there.
By the way, let's disclose, Michele won't say it, I will. Michele suffered from COVID in a very serious way early on. Check out our Lessons in Leadership program we did with Michele. That's a big part of it. I'm sorry, pick up your point, Michele, about Anibal.
Point being is that our community in the North Ward, although we were the hardest hit because they knew we were still there. We didn't abandon our community. And one of the reasons why we were able to do that is because of the strong leadership of our councilman, but also because of nonprofits and because of our relationships, and also the mayor. I think the mayor has done an outstanding
Mayor
job.
Ras Baraka.
Absolutely. To make our community feel that we will not abandon you. We're right there with you. And that's an important thing.
A few minutes left. Anibal, let me ask you this. Disproportionately, the COVID has disproportionately affected people who are Black and brown, Black Americans, Hispanic Americans, others. The North Ward is large. You describe the population of the North Ward for folks.
Well, it's predominantly Hispanic, and within the Hispanic community, you have a cross-section of individuals primarily from Puerto Rico, Dominican Republic, Ecuador. We do have an emerging African-American community as well. And that's one of the reasons why we've really zeroed in on setting up these strategic partnerships around testing, because like Michele mentioned earlier, especially with our immigrant population, there's a sense of distrust with government. And that's a population within the city that the mayor, myself, and others have really focused on to get more actively involved in getting testing.
Marsha, final comments on this. Your foundation, the philanthropic community, how united is the philanthropic community in the mission that you just described during COVID? Or is every foundation, every philanthropic organization on their own?
Oh, I think it's somewhere in the middle of what you're saying. We definitely talk with each other. There's been a pooled fund set up that the United Way is housing that many of us have contributed to, and it's independent foundations like ours, it's corporate foundations, it's a whole range of foundations, and that fund is addressing urgent, immediate problems, mid-range problems, and also long-range problems in health, in housing, in food, in small businesses, all kinds of concerns that are caused by COVID-19. On the other hand, we do all operate on different schedules and in different, we give grants in different ways. So I think there's a little bit of each.
Yeah. Michele, final words here. Reason for not-for-profits to be optimistic moving forward in these incredibly challenging times. Go ahead.
We have to stay strong together. This is a pandemic like no other. And the only way we are going to get through this is if we continue to be cohesive as a community. And we always have to have hope, because this too will end. How we get there matters. What we do today matters for what we do tomorrow.
To Michele, to Marsha, to Anibal Ramos, I want to thank all of you for joining us, not just to talk about the role of not-for-profits, but to look at the North Ward of Newark as a microcosm of urban communities across New Jersey and America. Thanks to all of you. We appreciate it.
Thanks, Steve.
I'm Steve Adubato. Stay with us. We will be right back.
Think Tank with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by the Robert Wood Johnson Foundation, University Hospital, Gibbons PC, Horizon Blue Cross Blue Shield of New Jersey, the TURRELL Fund, Supporting Reimagine Childcare. Johnson & Johnson, Berkeley College, the Fidelco Group, and by the Adler Aphasia Center. Promotional support provided by Jaffe Communications and by Meadowlands Chamber.
Hi, I'm Governor Tom Kean. A dear friend of mine had aphasia, which is a language disorder that occurs from a brain injury or a stroke. It robs a person's ability to communicate, but it doesn't affect their intellect. Programs and services offered at the Adler Aphasia Center help to improve my friend's communication skills, as well as her self-confidence and quality of life. Most importantly, she was among people who understood her. If you or a loved one has been diagnosed with aphasia, there is hope.